News Central now at this hour begins in Nigeria's capital, Abuja, where a downpour on Wednesday night has wreaked havoc on the Medium Security Custodial Centre in Suleja, Niger State, resulting in extensive damage to the facility and facilitating the escape of 118 inmates. Now, this was disclosed in a statement signed by the spokesperson, Federal Capital Territory Command of the Nigerian Correctional Service, Adamu Doza, on Thursday. Doza noted that the downpour caused severe damage to the custodial center's infrastructure, including a breach in the perimeter fence, which allowed the inmates to flee. In response, the NCOS swiftly activated its recapturing protocols, collaborating with other security agencies to recover 10 of the escaped inmates. Now, to discuss this, we're joined by principal partner, Benita law firm and independent resource person on security and justice issues, Ogu Ogechi. Hello, Ogu. Thank you so much for joining me at this time.
Madam, thank you.
All right, it's a pleasure.
Story. Yeah. Please turn your...
It's a pleasure to have you, Ogu. Now, Ogu, can you tell us, beyond the perimeter fence damage, were there any other security vulnerabilities exposed during the rainstorm? Were there any malfunctions in security systems or staffing shortages due to the weather?
Okay, in terms of other vulnerabilities, you know, the details are not yet fully out. And in terms of staff, the staff must have been around. There are some staff that are always in the custodial center every 24/7. So in terms of that, the staff must have been there. Whatever vulnerabilities the inmates may have faced, they too may have faced. Then in terms of security, it depends on the technology. You know, it's a medium security correctional center. So I don't think they have so much of such complicated, you know, technology, technology-based security gadgets in the correctional center. So more or less, I think it's the infrastructure, the building that is much affected in terms of defense, as we can see from the pictures that are shared there, and we know the reason for this. Of course, the integrity of the building is threatened by weather, by age, most of them. I know you must have seen the reports by US on custodial centers in Nigeria indicating that most, and this is a fact we all know, most of the custodial centers, some of them date back to over 80, 70 years during the colonial era. And you know the implication of this. Even our own personal buildings that are as old as that are not well maintained. We have these issues. We agree that the federal government is trying its best to, you know, upgrade, to rehabilitate some of these facilities. But it seems this is not happening as fast as should be, considering the security implications of this now. Of course, these people are let out into the community, and the safety and security of the communities have been threatened by this.
All right. Ogu, talking about safety and security of the communities, now out of 118 inmates that escaped, 10 inmates only have been recaptured now, leaving 108 out there. Now, do we have any information on the risk that these remaining escaped inmates pose to the public? And if you could actually tell us about the classifications of the inmates who are still at large.
Yeah, you know, I keep telling you, as an external person, not being a staff of the correctional center, nobody, you know, from outside can say for now the persons that are out there in the public, because this is an information that can only be given by the records, you know, by the correctional service itself. I know in terms of classification, they know the persons that are interning in their custodial centers, they have their details, And I know for now, the correctional service must be struggling, working with other security agencies to see that these persons are recaptured. And we are being hopeful because there's a lot of improvement in terms of documentation of inmates, means of identifying them. They are electronically captured. Their passport photographs are with this correctional center now, and they have this other new upgraded system mechanism of getting a nest of kin of these inmates, their details and the rest of them in their records. So I think they will be following up beyond what the general public can do in terms of using pictures of these persons to give information to them. I know they will be reaching out to families of these persons, whoever has been documented as next of kin of these persons, to give further information. But the point that must be made is this is one of the biggest issues that the correctional system faces, the criminal justice system entirely. We are still struggling, reform, and a lot. You can imagine out of that 119, you can be sure that over 50% of those inmates that escaped must have been persons on awaiting trial. And you see that most of them feel hopeless in situations where they stay on and their cases are not tried. Now, there are two things that must have happened in this circumstance. First is that the fence was falling down, and the very first law of nature is law of self-preservation. So nobody can be sure that these inmates escaped because they really wanted to escape. But seeing the building, the fence falling, they know that if it should fall on them, that is death for them. And actually, the sanction that has been given to them is not death sentence. And even if they were given that ultimate sanction, which is for those that have been convicted, even if they're on death sentence, the medium of executing that sentence is not by fence or walls of building falling on them and they're dying. It's not known in our laws. So that speaks to the core issue of human rights. What is the condition of detention? When you have taken away the freedom of a man, you took that freedom away for particular purpose. Let that purpose be what is meant and not bringing in other things that gets to the roots of their dignity, the roots of their respect as human beings, and the roots of humanity, which is their lives. So the expectation is that everything should be put in place to ensure that there is safety of inmates while they are in custody. This is quite critical. And in a situation like this, nobody has details as per the persons that maybe stayed behind. But you can be sure that if there are persons among the inmates that stayed behind, those may be the ones that are convicts, that have for certainty knowledge of when they will be leaving custodial center. When people are in custody and they don't have an idea of when they are going to leave or when their matters will be fully tried, you see that they are apprehensive.
All right. Ogechi, so sorry to interrupt you. Yes, but time is not on our side, and we definitely hope that this issue of prison escape it has become one too many, and we definitely hope that the right authorities look into the vulnerability of our correctional facilities and work on it as soon as possible. Thank you so much for joining us at this time.
Thank you.
Now, away from that, a fire outbreak on Thursday morning disrupted flight operations at the Murtala Mohammed Airport in Lagos, southwest Nigeria. The Director of Public Affairs and Consumer Protection of the Federal Airports Authority of Nigeria, Obiageri Ora, made this known in a statement on Thursday. The fire was reported to have led to the diversion of all flights operations from Terminal 1 of the airport to the D wing. Ora said the engineers at the airport have disconnected power from the entire E wing of the airport in an attempt to put out the fire. It was gathered that the incident sparked tension and panic at the airport, forcing some airport officials and travelers to scamper for safety. However, a fan team and the airport rescue and firefighting services have restored normalcy at the airport. Operatives of the Federal Competition and Consumer Protection Commission, FCCPC, have quizzed owners of a Chinese supermarket in Abuja over alleged discriminatory practices against Nigerians. FCCPC operatives also conducted an inspection of the facility, even as investigation progresses. In a post on X, the federal government agency said owners of the Abuja Chinese supermarket facing allegations of discriminatory practices responded to its summons to answer questions regarding the allegations. The FCCPC had shut the Chinese supermarket on Monday over alleged discrimination against Nigerians. The supermarket, located at the China General Chamber of Commerce along Umaru Musa Yar'Adua Road in the Federal Capital Territory, was set to exclusively permit individuals of Chinese origin to enter. A former Senate spokesperson, Ogu Ogechi, has died at the age of 65. Ogechi who represented the Enugu North Senatorial District between 2007 and 2015, passed away on Thursday in Abuja Hospital after suffering from an undisclosed illness. Ogechi, who is also one of the founding members of the People's Democratic Party, was confirmed by the Senate in May 2023 as a Federal Commissioner for Revenue Mobilization, Allocation, and Fiscal Commission. In his years at the Senate, he also served as the chairman of the Senate Committee of Works and a member of committees on constitutional amendment, police affairs, national planning, marine transport, and federal character and intergovernment affairs. Now let's head to politics, where the Ondo State People's Democratic Party governorship primary election, scheduled for the 25th of April 2024, has been held. The primary was conducted by a 7-man primary election committee headed by Bayelsa State Deputy Governor Lawrence Erujakpo. Erujakpo said 7 aspirants were cleared by the Senator Sam Egu screening committee to participate in the primary election. A total of 627 delegates from the 18 local government areas of the state participated to elect a standard bearer of the party for the November 16, 2024 governorship election. Voting has ended and counting of votes is ongoing. The hotly contested demolition of landmark beach resort for the Lagos-Calabar Coastal Highway project was the focus of the town hall meeting held earlier today, Thursday. Now, the event, hosted by News Central Television, brought together business owners, residents, and other critical stakeholders. Take a listen.
The landmark, known for its various businesses from the 90s in Europe and America, pivoted into Africa by owner Paul Owunibe and a few other investors. The brand, which has grown into vast markets creating avenues like event centers, hotels and resorts for Nigerians, now faces a hurdle. The ongoing crisis is a result of the demolition of the landmark beach for the construction of the Lagos-Calabar Coastal Highway. It has led to the abrupt stop of over 80 businesses, and local business owners are echoing the worries, fearing that the demolition could cripple the area's tourism sector.
I want you to look at the humans behind these businesses. I know that it's not just a business, it's a family, and we need to save that family.
The young people that we have, a lot of them, most of them, if not for these businesses and opportunities given to them, most of them would have been on the streets. They would have been doing drugs and all. But because we gave them an opportunity, we gave their lives a meaning, they are able to have something that they can use to support their family.
Young entrepreneurs are worried about the loss of jobs and investment.
I don't know of any place in Lagos or in West Africa that you can rent a space, rent an office space, rent an apartment, stay in a hotel, go to a restaurant, have somewhere to keep your children while you're having fun. If this was to be destroyed, it would be very difficult to replace it.
Speaking on the role of the government in today's Nigeria, News Central's managing director addresses the government on a better approach to tackling such issues, noting that the majority's interest is paramount.
If the government wants to do something, by all means, if it is in the interests of all Nigerians, or even majority, you will find a minority that might not want to enjoy it. But if it is majority of Nigerians stand to benefit from it, by all means, the government should be encouraged to do it. But the big but there is that the government is supposed to be the representative of the people. That means they owe us a duty to do first and foremost, above all things, to listen to us.
Although the government insists that the landmark property predates the coastal road plans, the question remains whether this is the best way forward. However, News Central's Town Hall series will continue to delve deeper into diverse issues and viewpoints.
Bridging the inequality gap is one of the goals the International Telecommunication Union seeks to achieve on a day such as International Girls in ICT Day. The day, celebrated on April 25th across the world, aims to cultivate the presence and digital skills of young women and girls in the STEM career field, particularly ICT. The 2024 theme is Leadership, underscoring the critical need for strong female role models in STEM. Hence, experts emphasize on funding and mentorship as a major requirement for young women and girls to succeed in this career. News Central's Omolola Ololade has more in this report.
Less than 30% of science, technology, engineering, and mathematics STEM professionals are women. Still, the gender divide seems to be gradually closing, with more women and girls showing more interest in STEM. While some women are still afraid to make career choices in STEM, others have shattered glass ceilings in this profession, paving the way for younger generations. For these secondary school girls, delving into technology, especially in artificial intelligence and robotics, is a game changer.
I believe that artificial intelligence can bring a whole big change in the aspect of education, and especially in Nigeria, because most people feel like we Nigerians, like we are not up to the task. That is one of the main reasons why we came out with Okikiola Shagamu, to show girls, because most times inferior complex and all those, to show girls that we can do it, we can actually make it, we can make a change in our environment.
Experts applaud the progress made in bridging the digital divide and workplace imbalance. They noted the importance of funding and mentorship for young girls to pursue a career in STEM.
We have a lot of kids that wanting to dominate the world, do things, but if they don't have the right mentor, it's very hard technology to move. So really need the right funding, easy access to governance for, startups, especially kids that wanting to push and do great things, solving great problem, utilizing technology.
I think funding, and I know that that's a very well-traveled route, like people always say funding, but beyond that, I think that opportunity to access the resources that they need, not just even the money, the sort of mentorship, the sort of guidance, like how do I actually develop my idea? How do I have access to light? How do I have access to the basic thing?
Inequality is still evident in the 21st century. The need for inclusion, equity and diversity of women in STEM remains important to a country's economic growth.
Girls can make invaluable contribution to society and deliver change, capable of profoundly impacting the community they live in, especially through digital. Fostering a greater presence of girls and women in the tech sector generates much-needed inclusivity in the design and development of digital tools and platforms.
Experts, however, believe that remarkable progress will be made in the coming years if we foster equality, particularly in the STEM sector in Nigeria. In Lagos, for News Central, Omolola Ololade.
In a bid to commemorate the 2024 World Malaria Day, the Pediatric Association of Nigeria, PAN, has stressed the need to not relent in the ongoing fight against malaria, with a focus on the theme, accelerating the fight against malaria for a more equitable world. Let's change the narrative now. Professor Ekanem Ekure, president of PAN, noted that malaria accounts for 60% of outpatient visits and 30% of hospital admissions in Nigeria, making it the leading cause of death among children under 5. In 2021, Nigeria recorded 68 million malaria cases and 194,000 deaths, with approximately 80% of those cases involving young children. Despite progress in combating malaria, much more needs to be done to protect vulnerable populations. PAN acknowledged existing efforts in deploying vector control, chemo prevention, and improved anti-malarial treatment, but outlined a need for additional strategies. Now, to discuss this, we're joined by Dr. Zakari Usman, Chief of Party Partners for Healthcare Nigeria. Hello, Doctor. Good evening, and thank you so much for joining us.
Good evening, and thank you so much for having me. It's actually partner in health.
Yes, indeed. All right. So, Doctor, can you share with us the primary barriers that children and Nigeria actually has to equitable access to malaria interventions in the country?
Oh, thank you so much. Primary barriers to equitable access to malaria prevention, basically, it's multifaceted. One of them is the geographical barrier. There are some people who live in places tagged as hard to reach areas, people who live in hard terrains, people who live in the creeks, people who live in the riverine areas where appropriate means of transportation are not available, and some persons that live in IDP camps. Those some of them are not easy to reach geographically. Others, other facilities, some places do not have healthcare facilities, some are poorly equipped. There is also the socioeconomic divide. Some persons do not have the financial power, to access healthcare, and even when they do, it's almost impossible for them to pay for the services. That also is one of the reasons why one of the barriers, to malaria prevention. Equally, the issues around healthcare practitioners, the knowledge of the healthcare practitioners, the availability of facilities in terms of diagnostics. For malaria, we have the rapid diagnostic test, which has made diagnosis of malaria cases a lot easier as against the microscopy that we used to do in times past. But these items are not equitably distributed across all healthcare facilities. There's also the issue of stockouts, of essential drugs in most health facilities. So some of these are what cause the barriers, as well as issues around gender inequity and gender inequality.
All right, Doctor.
All right, Doctor. As a result of.
If you can hear me, Dr. Usman, has there been any collaboration between, the Nigerian government, between them and health practitioners and other partners, especially in tackling malaria? If yes, what specific approaches are showing promise in reducing the malaria burden among children? Because we know in some countries they've already started vaccinating children against malaria.
Yes. Oh, thank you so much. Yes, there's been a lot of partnership. It's a multi-sectoral approach. And there's been a lot of partnership with sub-national governments, with development partners, with international donor agencies, with even corporate bodies. One of such partnership is what you just heard earlier. The Pediatric Association of Nigeria have come out to show their support, for efforts towards malaria control. That's a partnership that works for us. And of course, we have also had some form of support from the USG through the President Malaria Initiative. There's an ongoing program across some states, I think about 12 states, I think, on impact, which is one malaria. Some of them are supported by World Bank, some are supported by Islamic Development Bank. All of them are geared towards providing, the supply chain items, the drugs, the logistics, malaria preventive logistics, like the long-lasting insecticidal nets and all of that. And talking about which of the approaches has worked, in malaria prevention, basically is a multi-pronged, multifaceted approach. For children under 5, one of the ones that has demonstrated a lot of potentials to help go a long way to reduce the burden, both in mortality and morbidity of malaria, is the seasonal malaria cable prevention. Under the seasonal malaria cable prevention, what happens is that they use a drug combination. They call it SPAC. It's sulfadoxine, pyrimethamine, and amodiaquine combination. And it is targeted mainly from April to October, around the rain period, around the rainy season in Nigeria, so that at least they can reduce incidences of clinical cases of malaria,
okay, now,
severe forms of
talking
malaria,
about,
and even
yes,
prevent the children
talking
from having
about
malaria.
these incidences, Doctor, what role do you think that health practitioners can play in addressing gender inequalities and discrimination that contribute to a heightened risk of malaria?
Thank you so much. The healthcare inequality as regards malaria, one is self-development, to know, what the challenges are, and then of the community in terms of what is required, what is even the gender discriminatory, what constitutes.
All right, we seem to be having issues connecting with Dr. Usman, but thank you so much, Doctor. We appreciate you for your time and speaking on this. Now, away from Nigeria, supporters of Chad's transitional president, Muhammad Idris Deby Itno, gathered in solidarity on Thursday ahead of his campaign rally in Mondu, the country's economic capital and an opposition stronghold. They claim they decided to support him and give him another 5-year term because he proved himself during the transition period. Itno, who was proclaimed president by the army 3 years ago, is projected to win the presidential election following the army's deadly assault on one of his main rivals, Yaya Dillo, and the invalidation of other candidates by a constitutional council whose members he appointed.
Ouais, bon, je soutiens M. Midi Mohamed Idriss Deby Itno parce qu'il nous a bien aidé à gérer la transition. Donc je pense qu'il va aussi bien gérer le pays quand on l'élu à la tête vraiment comme notre président.
Donc les candidats Midi, si nous les soutenons ici, jusqu'à nous avons effectué ce déplacement, tant d'autres villes que nous avons effectuées, c'est parce qu'il a fait ses preuves pendant la période de transition que nous sommes ici pour le suivre et le soutenir, pour lui accorder encore un mandat de 5 ans. Et ce mandat de 5 ans...
The European Commissioner for Human Rights has called on Britain to scrap its plan of deporting asylum seekers to Rwanda. Now, this comes after the United Kingdom passed a bill to deport an asylum seeker who is in the country illegally. Now, European highest right body says the United Kingdom government should refrain from removing people under the Rwanda policy and reverse the bill. The asylum seekers would have to await a decision on their application in Rwanda. The first flight carrying illegal immigrants from the UK to Rwanda is set to depart in July. Now let's move to other news. In the heart of Johannesburg in Hillbrow, where the city's pulse beats to a different rhythm, a dark shadow looms over its streets. Tragic scenes have become all too common in this community. Now, for young ones, the lure of drugs has become their reality, taking away their freedom and sanity. Join us as News Central's Bongani Siziba takes us to the darkest corners of Hillbrow, where the cries of the youth echoes through the streets, drowned in their sorrows and addiction.
This is Johannesburg, an economic hub also dubbed as the wealthiest city in South Africa. But amidst the glitz and glamour, there is a dark side to the city streets. Hillbrow is a neighborhood known for its notorious crimes, and some of its streets have become drug corners where youths have been swallowed by the grip of addiction. On these streets, on one side, young youths have made this corner their home. Every morning they wake up with their eyes gazed over across the same street, waiting to feed the monster of addiction from their alleged drug lords, who also camp here all day, ready to prey on these vulnerable individuals. And in my quest to investigate more about this corner, I was met by this alarming yet painful episode unfolding in front of my eyes. A man injecting heroin in his arm, looking gaunt and desperate. While still alarmed, I was told by one gentleman who looked sober that these tragic scenes are all too common. So I asked him who he was, and after a few minutes of chatting, we sat down just to understand all this. Here, these drug addicts use a method called Bluetooth. This is a method where a drug addict injects drugs into their bloodstream, and sometimes another addict draws out the blood and then injects it into their own bloodstream. So I asked one addict,
how did you start getting into drugs? When did you start? What happened for you to see yourself into this?
In the beginning, it was a social thing, you know, and then afterwards it became a necessity, especially my drug that I use. I couldn't just use it today and then next week I use it again. It became an everyday thing. And not only that, my body started wanting it more and more, even though my mind was saying, no, I've had enough of drugs.
What started as a brief escape from reality has turned into a haunting nightmare for these young souls.
It's a small solution for a permanent problem, you understand. It's something small like this. I'm thinking in my mind that it's going to take away all my pains, take away the love, the trust that I lost from family and stuff. Now I use it, and then only to realize afterwards all those problems, if anything, it's even worse.
It's heartbreaking to see so many young people succumbing to the lure of drugs. They are our future, and right now, that future looks so bleak.
I was lucky to meet this man, Malusi Makaula, a former drug addict who knows too well the destructive power of addiction. He was here to share his story and hopefully make a difference in the lives of those who are still trapped in the cycle of drugs. This was once his home. Malusi was once one of them, a promising young man with dreams and aspirations, but the grip of addiction slowly consumed him, leaving nothing behind but a shell of his former self.
What made you leave the streets? Because some of them, they are saying it's very difficult to be a drug addict and also leave drugs. But you are one man who has managed.